Living with systemic lupus can be challenging, but with the right medications, it's possible to manage the symptoms and improve quality of life. In this video, we will take a closer look at the top 5 medications that are considered lifesavers for individuals with systemic lupus. Understanding systemic lupus. Systemic lupus erythematosus, commonly referred to as lupus, is a chronic autoimmune disease that affects various parts of the body. It occurs when the immune system mistakenly attacks healthy tissues and organs, leading to inflammation and damage. Lupus can affect the skin, joints, kidneys, heart, lungs, and brain, causing a wide range of symptoms such as fatigue, joint pain, rash, fever, and organ dysfunction. The exact cause of lupus remains unknown, but it is believed to be a combination of genetic, hormonal, and environmental factors. While there is no cure for lupus, various treatment options, including medications, can help control the symptoms and prevent flare-ups. Importance of medications in managing lupus. Medications play a crucial role in managing systemic lupus. They help reduce inflammation, suppress the overactive immune system, alleviate symptoms, and prevent organ damage. It's important to work closely with a healthcare provider to develop a personalized treatment plan that takes into account the individual's specific symptoms and overall health. While medications are an integral part of lupus management, they are not the sole solution. Lifestyle modifications, such as maintaining a healthy diet, exercising regularly, minimizing stress, and protecting the skin from sun exposure, are also vital in managing the disease. Common medications for systemic lupus. There are several medications commonly prescribed to individuals with systemic lupus. Let's take a closer look at the top 5 medications that are considered lifesavers in managing the disease. Hydroxychloroquine. Hydroxychloroquine, commonly known as Plaquenil, is an antimalarial drug that has been used for decades to treat lupus. It works by reducing inflammation and suppressing the immune system. Hydroxychloroquine not only helps control lupus symptoms but also reduces the risk of flare-ups. This medication is typically well tolerated and has relatively mild side effects. However, regular monitoring of eye health is necessary, as hydroxychloroquine can rarely cause retinal damage. Overall, hydroxychloroquine is considered a cornerstone medication in the treatment of systemic lupus. Nonsteroidal anti-inflammatory drugs, NSAIDs. Nonsteroidal anti-inflammatory drugs, or NSAIDs, are commonly used to provide relief from pain and inflammation associated with lupus. Medications such as ibuprofen or naproxen can help alleviate joint pain, muscle aches, and fever. NSAIDs work by reducing inflammation and pain by blocking the production of certain chemicals in the body. While NSAIDs can be purchased over the counter, it's important to use them under the guidance of a healthcare provider, as long-term use or high doses can have adverse effects on the stomach, kidneys, and cardiovascular system. Additionally, individuals with lupus should be cautious when using NSAIDs, as they can interact with other medications prescribed for the disease. Immunosuppressants. Immunosuppressants are medications that suppress the activity of the immune system, thereby reducing inflammation and preventing the immune system from attacking healthy tissues. Methotrexate is one such immunosuppressant commonly prescribed for individuals with lupus. Methotrexate can effectively suppress the overactive immune system and reduce inflammation. It is often used in combination with other medications, such as hydroxychloroquine or corticosteroids, to achieve better control of lupus symptoms. Methotrexate may have side effects, such as liver toxicity, so regular monitoring is necessary. Other immunosuppressants, such as azathioprine, mycophenolate mofetil, and cyclophosphamide, may also be used in certain cases to manage lupus. These medications are typically reserved for more severe forms of the disease or when other treatments have been ineffective. Corticosteroids. Corticosteroids, such as prednisone, are commonly prescribed to manage lupus symptoms. These medications work by suppressing the immune system and reducing inflammation. Corticosteroids can provide rapid relief from symptoms and are particularly effective during lupus flares. However, long-term use of corticosteroids can have significant side effects, such as weight gain, high blood pressure, osteoporosis, diabetes, and increased susceptibility to infections. To minimize these risks, corticosteroids are often used in the lowest effective dose and for the shortest duration possible. They are also frequently used in combination with other drugs to achieve better symptom control while minimizing side effects. Biologic response modifiers. Biologic medications, such as rituximab, are a newer class of medications that are designed to target specific immune cells involved in lupus. These medications block the action of certain cells, such as B cells, which play a role in the development of lupus symptoms. Rituximab, in particular, has shown promising results in reducing disease activity and improving overall well-being in individuals with lupus. It is typically reserved for individuals who have not responded well to other treatments or have severe lupus manifestations. Biologic medications are administered through intravenous infusion or subcutaneous injection and are usually given in combination with other medications. While they can be highly effective, they may also carry risks, such as increased susceptibility to infections, so close monitoring is necessary. Other treatment options for lupus. In addition to the medications mentioned above, there are other treatment options available for individuals with lupus. These may include anticoagulants to prevent blood clots, medications to manage specific symptoms such as skin rashes or kidney involvement, and immunomodulatory drugs to regulate the immune system. It's important to note that the choice of treatment depends on the individual's specific symptoms, overall health, and preferences. Regular follow-up with a healthcare provider is crucial to monitor the effectiveness of the chosen treatment and make any necessary adjustments. Conclusion: finding the right medication regimen for you. Managing systemic lupus requires a personalized approach, and medications play a vital role in that journey. Hydroxychloroquine, nonsteroidal anti-inflammatory drugs, immunosuppressants, corticosteroids, and biologic response modifiers are among the top medications commonly prescribed for individuals with lupus. However, it's important to remember that medication is not the only aspect of lupus management. Lifestyle modifications, regular checkups, and open communication with healthcare providers are equally important. Finding the right medication regimen often involves trial and error, as what works for one person may not work for another. If you have systemic lupus, consult with your healthcare provider to determine the most suitable options for your specific needs. Together, you can create a comprehensive treatment plan that helps you manage your symptoms, reduce the risk of flare-ups, and improve your overall quality of life. Remember, with the right medications and support, living well with lupus is possible.